Good evening. I would like to welcome you to the 17th Annual Thewlis Lecture on Gerontology and Geriatrics here at the University of Rhode Island. I'm Phil Clark, Director of the Rhode Program in Gerontology and the Rhode Island Geriatric Education Center. We are pleased that you can join us for this special virtual event. Mindfulness has gotten increased attention recently for its positive effects on both mind and body. We chose this year's topic because we wanted to highlight the connections between aging and brain health, a growing concern for many people as they work to maintain their health as they grow older. At this time, I would like to introduce two URI colleagues, Dr. Patrick Vivier, the Dean of the College of Health Sciences, to bring greetings from the university, and Dr. John Robinson, the co-executive director of the George and Ann Ryan Institute for Neuroscience, our co-sponsor of this lecture.
Welcome, everyone. I'm pleased to offer my welcome on behalf of the University of Rhode Island. The university is pleased to offer this year's Thewlis Lecture, focusing on the connection between aging and neuroscience. Health is a major focus of research and education here at URI, and we're especially excited about promoting interdisciplinary connections that draw on the strengths of different fields. Tonight's lecture showcases two important centers at the university that are engaged in exciting research and education: the Rhode Island Geriatric Education Center and the George and Ann Ryan Institute for Neuroscience. We're delighted that they came together to co-sponsor this year's Thewlis Lecture on Gerontology and Geriatrics. Thank you for attending and engaging with us in this exploration of the fields of aging and neuroscience. So I'm now happy to turn things over to Dr. John Robinson from the Ryan Institute.
Thank you, Dean Vivier. The Ryan Institute is delighted to be co-sponsoring this long-running and prestigious lecture for the first time. The mission of the Ryan Institute is to explore new paths for research in neurodegenerative disease and healthy brain aging, including those involving lifestyle and the environment. Mindfulness is one of those emerging paths to long-term brain health, and we are thrilled to have a field leader like Dr. Prakash here with us tonight to talk about her work. We thank you, Dr. Prakash, for sharing your knowledge of this topic, and we thank all of the audience for being with us this evening. Dr. Phil Clark will now say a few words about the history of the lecture and introduce our speaker.
Thank you, Dr. Robinson. I would like to provide a brief glimpse into the reason for the name of this annual lecture. Dr. Malford Thewlis was one of the founders in 1942 of the American Geriatric Society, the major professional association in the U.S. in geriatric medicine. He was an author of an early textbook on geriatric medicine, first published in 1919. Interestingly, Dr. Thewlis was also a resident of Wakefield, Rhode Island. In the 1940s, he was a special consultant to the Rhode Island Department of Health, and he was an attending physician at South County Hospital. We are pleased to have this memorial lecture for a pioneering geriatrician from the state of Rhode Island. It is now my pleasure to introduce our 2024 Thewlis lecturer. Dr. Ruchika Prakash is director of the Center for Cognitive and Behavioral Brain Imaging and the Distinguished Professor of Psychology at The Ohio State University. Her research focuses on evaluating mind-body interventions to improve cognitive and emotional health in older adults and also in those with neurological conditions using neuroimaging and neuropsychological methods. Her achievements have been recognized with several awards. Among them are the Rising Star designation from the Association for Psychological Science in 2013 and the Springer Early Career Achievement in Research on Adult Development and Aging from the American Psychological Association in 2016. During the lecture, we invite you to submit your questions by clicking the comment icon on your control panel. We will be grouping these by topic to present to Dr. Prakash at the end of the lecture. I would now like to turn the program over to our Thewlis lecturer for 2024, Dr. Ruchika Prakash. Dr. Prakash.
Thank you, Dr. Clark, for that very kind introduction and for inviting me to give this very prestigious lecture on gerontology and geriatrics. It really is a privilege to be able to do that. Good evening, everyone. I hope you all can hear me. Thank you very much for taking time out of your evenings to join me in this lecture on mindfulness and mindfulness and the aging brain. So I know that we've been having some technical glitches, and I always say that whenever you're doing webinars, and I think the era of COVID has taught us that this is the perfect time to practice mindfulness, to just take a pause, take a moment, and come back to the present moment. So if your computer dies down, if the internet goes away, if Facebook stops working, no big deal. We're going to be still here. You can join us 5 or 10 minutes later. So today I'm going to be talking to you about the impact of mindfulness on the aging brain. Let me make sure I can move through my slides. So my plan for today is to really just start with defining mindfulness and talking to you all about the research program that I have been spearheading at Ohio State, looking at the effects of mindfulness and attentional control for healthy older adults, as well as some of our brain imaging data that we have been recently starting to acquire and analyze. I'm going to also be talking about, should mindfulness be thought of as a panacea, as the be-all and the end-all? Spoiler alert, it's really not. And I'll tell you why. And I will also highlight some of the future directions of our work. Now, before I give any talk, I'd really like to start by defining what is mindfulness. Right, mindfulness is all the buzz right now, as Dr. Clark was mentioning. You see that corporate organizations like Google, they have mindfulness pods. If you go to the airport, TSA agents are talking about being mindful. Somehow, TSA agents and mindfulness doesn't really go together. But there are lots of different ways in which people have been talking about mindfulness. So how do we even begin to start defining that? So this is a definition by Jon Kabat-Zinn, who is considered to be one of the founding figures of the field of mindfulness meditation within the Western world. And how he defines mindfulness really has formed the crux of how we tend to approach it in our research studies. So mindfulness means paying attention in a particular way. So it's on purpose, that is, it's intentional. You are attending to the present moment, and you're doing so in a non-judgmental and accepting framework. Here's another definition by a leading mindfulness scholar, Jack Kornfield. Mindfulness is an innate human capacity to deliberately pay full attention to where we are, to our actual experience, and to learn from it. And finally, by Pema Chodron, mindfulness is an open attentiveness to whatever is showing up and arising for you. Now, mindfulness-based stress reduction, and in fact, this technique of these mindfulness meditative practices really have been taught within the United States and in much of the Western world through this mindfulness-based stress reduction program. It's an effective and evidence-based program that was developed by Jon Kabat-Zinn at the University of Massachusetts Medical Center in 1978. Now, the program and elements of it exist all over the world. So I don't know if I mentioned, it is an 8-week intervention, so it's spread over 2 months, and it's really offered all over the world. You see mindfulness-based stress reduction programs being offered at hospitals, in clinics, schools, senior citizen centers, and corporations around the globe. Now, there have been a number of research studies on this topic. Many books have been written, and media offerings are abound as well. Now, mindfulness, in the context of these MBSR programs, really is this attention that arises out of intentionally paying attention in an open, kind, and discerning way. Now, that was a mouthful. So the 3 components of mindfulness that end up being the cyclical process between attitudes, intention, and attention. So mindfulness is really about having this intention. All of these definitions that I just presented to you, they were really talking about that this is deliberate work. We have to be constantly intentional about it. And what we're doing is we are doing so in a framework of these attitudinal foundations. Anyone who has ever engaged in meditative practice can attest to the fact that attending to the present moment experiences, just showing up for whatever is happening for you in the present moment, is not always the most pleasant. But we really work with our participants and with our clients to ensure that when they're attending to these present moments, they are cultivating these attitudinal foundations of non-judgment, of acceptance, trust, letting go, non-striving, patience, beginner's mind, trust, gratitude, and generosity. And a lot of the times, these attitudinal foundations are really what's important. We call them the soil through which you can cultivate your ability to calm your mind and to relax your body, to concentrate and see more clearly. And it's this attention that arises that we study through mindfulness meditation. Now, a lot of people in here probably have engaged in mindfulness practices or have heard about mindfulness-based stress reduction program. So I always like to show this schematic to just give you an overview of the different practices in mindfulness-based stress reduction programs. So I don't know if you can see my cursor right here, but there are these focused attention practices. So this is often what we start with when we first get anyone started in the mindfulness-based stress reduction program. And here, the invitation is to really hold one phenomena at a time. So a good example in this case is breath awareness practices. So we start by inviting our participants to really just focus on the in-breath and the out-breath. And breath is the perfect anchor for us to use, right? It's something that we're born with, and it's with the last breath that we're going to transition. So focused attention practices really are about cultivating this attention, again, in a non-judgmental and accepting framework on one phenomena at a time. So starting with breath awareness practices, we move on to attending to emotions, this range of emotions that we're engulfed by in any given day, different thoughts that come to mind. I'm going to talk a little bit later about mind wandering and how any given day there's so many different thoughts that we have. So how do you sit with this? How do you learn to accept that? And so the first 3 to 4 weeks really are spent in these focused attention practices. And then we move on to what are called open monitoring practices. Here we open up the realm of awareness to all of these phenomena that come up for us at any given time. So if you sit in a meditative practices, chances are you will think about maybe 10 to 15 things. Maybe you'll hear different sounds in the room. Maybe you'll start noticing that your back is hurting. So we open our awareness and learn to accept all of these different phenomena as they're unfolding. And now there's a lot of focus in MBSR practices on using nature as an analogy to practice mindfulness. So we have our participants engage in things like mountain meditation and lake meditation. And then beyond just these practices, focus, attention, and open monitoring, all of these practices really are designed to cultivate what's called intrapersonal mindfulness. So we really are working on gaining a better understanding of who we are as individuals. But there is also a realm of mindfulness where you can go from intrapersonal mindfulness to interpersonal mindfulness. And here researchers are looking at the effects of how mindfulness training, and this includes things like gratitude meditation and compassion training, how do these interventions can have an influence on your relationships. So this is just to give you a broad overview of the different practices in mindfulness-based stress reduction programs. But let's bring it back to mindfulness and attentional control. The first randomized controlled trial was conducted in 1973, looking at the effects of mindfulness on attentional control. So one of the things my graduate student and I did, along with a number of other co-authors, was we wanted to do a scoping review of the literature. So this was a study that was published in 2020, but we finished the analyses in 2019. So we looked at all of the different studies that had been published from 1973 all the way up to 2019, and we basically evaluated every study for how strong of an evidence did it provide that mindfulness could benefit facets of attentional control. And I'll go over this graph in a little bit more detail later, but this is just to present to you the scope of the landscape of the research. So from 1973 to 2019, about 57 studies were done. And one thing that I think has been clear through these definitions that I have been giving to you, the overview of the MBSR practice, is that attention really has been central to the construct of mindfulness. If you're someone who really enjoys reading the teachings of mindfulness, you know that now a number of different mindfulness scholars really talk about using attentional processes to alter information processing, influencing our emotional experiences, thought processes, and sensations. I just discussed with you different formal practices that you do as part of the mindfulness-based stress reduction program, and almost all of them rely on some kind of an attentional process to focus on either a specific anchor, such as the breath, or various other phenomena. Now, as researchers, we love developing measures, and there are a whole host of measures on mindfulness, and they vary quite a bit in terms of the facets that they tend to emphasize. But one thing that is common across all of these measures is the ability to sustain attention. Now, if you really look at the literature on attention, there are so many different tasks that can measure attentional control. And I don't think that I have really defined attentional control, and I'll come to that in just a moment. But there is this very famous taxonomy, or a way of classifying different attentional tasks, that was proposed in the 1990s, where we basically classify attention into what's called the alerting component, the orienting component, and the conflict component. And the alerting is essentially just the readiness that we have. So let's say if you're sitting at home and a fire alarm goes off, are you alert to that, and can you pay attention to that and attend to that? Orienting is really about paying attention to the spatial location of location of the things. So, for example, right now you're looking at the screen, so that's so you know exactly where to look at. But again, if a fire alarm goes off, then your mind would be headed towards that direction. So that's more bottom-up processing as opposed to top-down that is happening here. And then the final component is this conflict component. which really helps us resolve at any given time. There are so many different things going on. In fact, just before this lecture, I have 2 young kids, and I was making sure that one of them ended up going to their track meet, the second one ended up going to her taekwondo class. So there's a lot of multitasking that we tend to do, and at any given time we have to prioritize what is it that we're going to focus on and how we're going to ignore other things. So when we looked at the literature in our scoping review, in terms of where do we have the strongest evidence, we have mixed evidence for these components of alerting and orienting, but we have the strongest evidence for executive control of attention. Again, as a reminder, this is about prioritizing what is important in this moment and kind of ignoring what may not be important in the moment. But another thing that I think really stood out to us was that when we looked at the different clinical trials that had been done with a critical lens, we evaluated every study using this figure right here. We found that many different studies, actually of the 57 studies, there were only 5 studies that met all of our criteria for a strong randomized control trials. There are all of these different criteria here, but the 3 important ones that I thought I would mention to you all. One is, we all have heard about randomized control trials, and what's in the name is randomization, right? So did the study randomize participants into 2 groups? So it's not that, participants were being able to self-select themselves. So it is known that if people self-select themselves into certain groups, they're going to benefit just because of those placebo effects right there. So randomization is at the heart of, is one of the gold standard methodology for evaluating the evidence for clinical trials. The second thing that's really important and that tends to get lost in a number of these studies is, did they compare it against an active control group? So in a number of early studies that were done with mindfulness meditation, what they did was they had a group of participants, especially the work that was done with healthy older adults, and a lot of these participants were retired. So participants in the mindfulness group, and I'll give you the example of Columbus, Ohio, they were asked to come into the lab once a week for 8 weeks to engage in mindfulness meditation. So that meant that the person got out of their home, they drove to Ohio State campus, they navigated all of the undergraduates who are on their phones and walking, and made sure that they drove right past through them and parked in a parking garage, came to the lab, interacted with the experimenters, interacted with the facilitators. Also, all of these sessions are done in a group setting. So after 8 weeks, a lot of them formed a community, and they used to go out to lunch after the class was over, or they would go out for happy hours, but they formed a community. And then we had the waitlist control participants. These people came in and did the assessments before the intervention, then did nothing for 8 weeks, and then came back and did the assessments. Any guesses on which group got better? Of course, the mindfulness meditation group got better. So what we have been advocating for, and very actively advocating for, no pun intended, is the inclusion of an active control group. So you really want to, in a randomized control trial, know that it is your intervention that is having an influence, and it is not just different elements like social support, or the fact that the participants are having interactions with experimenters or facilitators, or they're just doing some kind of a cognitively stimulating activity that they're getting better. So that's a second key component of a randomized control trial. And the third one, which gets very little attention, is reduction in demand characteristics. Now, I'm a clinical psychologist by training. So when I'm seeing my clients in a therapy session and they think that they're going to get better, that is fantastic, because people who think that they're going to get better actually do get better. But when I'm assessing the effect of an intervention, I want to make sure that the expectancy is the same between my intervention group as well as my control group. So both the mindfulness group as well as my active control group, both groups expect to get better. It's okay if the mindfulness group is expecting slightly more, but really we want to make sure that both groups are exerting the same amount of attentional effort. So these are the three main ingredients that we evaluated every study that had been done from 1973 to 2019. And what we found that of all the studies that had been done, really 5 studies met all of our criteria. And 3 of them found that mindfulness training actually did not benefit cognition, and 2 of them found that mindfulness training did benefit attentional control. So we were basically at a point where we were unsure of whether mindfulness training causally can influence attentional control. So my lab launched 2 trials. One was the health study, and that's what I'm going to be talking about. But we also have a study that we completed with individuals with multiple sclerosis, and I'm happy to talk offline, or feel free to send me an email, and I'm happy to send papers on that. But the health trial really was designed to study the effects of mindfulness training on mind wandering and attentional control in older adults. So the primary aim, as I mentioned, was to look at these 2 variables, and I'll define those for you in just a moment: mind wandering and attentional control in older adults. We had 74 older adults that were randomized to either a mindfulness-based attention training program or a very active control group, which was lifestyle education training program, where we included stretching and toning exercises. It was psychoeducation based, so we provided a lot of evidence-based information on different lifestyle behaviors that could improve healthy aging. And our outcome variables were attentional control and self-reports of mind wandering. So let's define attentional control as we employed it in this study. So attentional control really is defined as this ability to select and amplify task-relevant information while ignoring information that's not relevant to the task, or it's irrelevant to the task. So let me give you an example of the task that we use. So it's called the go, no go task. It's a very long, continuous performance task. Essentially, our participants sit out in front of a computer screen. A big shout out to anyone who is attending this talk and who participated in either this research study or any other research study. We cannot thank you enough for your involvement in these studies. So in this task, for 30 minutes, they sat in front of a computer and responded to whether they saw an X on the screen or an M on the screen. So if they see an M, they press with the right index key, and if they see an X, they respond with an X key. You realize a very straightforward task, very simple task, but can get long and boring. So these are the go trials. The no-go portion is, so they're responding, and then they hear a tone. And when they hear a tone, they're supposed to withhold their response. So those are your no-go trials. So we are making sure, so that's what we're assessing, is what's called the signal detection score. So the extent to which you can respond correctly on your go trials, and then also withhold your responses on the no-go trial. And that really gives us an index of your attentional control abilities. The other thing that we assessed was what is called reaction time variability. So when people are responding, we can collect data on how fast or slow they're going. Usually, people have a pretty similar cadence throughout. The 27 to 30 minutes, but sometimes some people respond really fast or really low. So they have a ton of variability in their reaction time, and that's what we measure with this RTCV variable. Here's another variable that we measure. That's called mind wandering. This refers to the shift in attention away from the task at hand and towards internal thoughts. Well, what do I mean by this? So let's say you're attending a lecture, similar to this right here. You're following along with me, right? So we just covered attentional control. Now we're talking about mind wandering, and you are with me with this lecture. So this is what we describe as on-task thought. Or you could be sitting in front of your computer screens, and you could be like, what did she say was the hits minus false alarms? And what was that reaction time variability? So you're thinking about the task. You're still with me on the lecture, but you're thinking about the slide before. You're not on this mind-wandering slide. So that is called task-related interference. And the final one, which I hope none of you are engaging in, is what's called task-unrelated thoughts. So nobody here is making dinner plans, or actually it's getting late for dinners, or maybe making dessert plans, are thinking about, well, solar eclipse is happening in Ohio on Monday. I wonder if she is going, or where did she get that cute top from? So hopefully nobody's engaging in task-unrelated thoughts right here. But we can really ask about mind wandering to what are called self-report probes in these 27 to 30-minute long tasks. So our participants are basically responding to the task XM, and that's on task thought. And then task-related interference would be an example where they could be like, well, I outsmarted the timing of the beep. I think the X will show up next. So they're kind of, drifting away from the task at hand. They're still thinking about the task, but they're kind of away. And unrelated thoughts, I wonder how my daughter is doing at her conference. I think my mom is attending this lecture as well, so she's probably thinking about that. What will I fix for dinner tonight? So basically having thoughts that's not related to the task at hand. And what we do is we present these quasi-random probes, mind-wandering probes. So people are doing the task. They don't know when these prompts are going to come up, and they just basically come up on the screen. And we ask them to press 1 if your mind was on the task, press 2 if you were thinking about performance on the task, press 3 if you were thinking about personal worries, daydreaming, fantasizing, or just lost in thought. And we give a lot of training before participants engage in these practices. We give a lot of training to participants to classify between task-related interference and task-unrelated thoughts. And together, this forms mind wandering. Now, a question that I often get is mind wandering bad for us? As a researcher, I can also tell you that mind wandering is associated with creativity. So there are studies that have shown that when people are engaged in mind wandering, that is when they can also be the most creative. And there are also other good advantages to engaging in mind wandering. But mind wandering also has functional costs associated with it. So this is a graph where on the left-hand side, you see what's called accuracy. And on the right-hand side, you see what's called reaction time. So just how fast you're responding to the stimuli. In black lines, you see older adults represented. And in the gray lines, you see young adults represented. And on your x-axis, you see what's called off-task. And again, I don't know if you all can see my cursor, but off-task is when people report that they're engaging in mind wandering, and on-task is when they report that they are focused on the task. As you can see, that both for older adults as well as for younger adults, performance on off-task, especially for the no-go trials, this is when you're supposed to withhold your responses, really suffers as compared to performance on task. So if you look at these bars at off task compared to on task, and the same thing for reaction time. This is a graph that I often show to undergraduates when I teach here at Ohio State, because they're always like, well, I can practice mindfulness and I can not do mind wandering when I'm an older adult, but right now I have all the cognitive capacity to do that. And this data and many other such data sets have shown that mind wandering has functional consequences for everyone. So it impacts lecture comprehension, it impacts reading comprehension, it impacts your performance on the task. So the next time your child or grandchild can say that they can multitask, you can let them know that, no, we have evidence that you are not able to do it successfully. So mind wandering really has functional costs for us. So bringing you back to the results of our clinical trial. So what we found was that when we have older adults engage in mindfulness training and other older adults who engage in lifestyle education training, we see a reduction in mind wandering. So the red bar right here, I have to use scarlet and gray, it's Buckeye colors. So the red bar right here basically shows that after training, the mindfulness participants showed a reduction in task-unrelated thought, especially when you compare them to participants in the lifestyle education group. Now, in the research world, sometimes we tend to say, well, self-report is great, right? We collected self-report data, but what about objective metrics of performance as well? And so on the right-hand side, under B, what you see is what's called reaction time coefficient of variation. So this is your variability in reaction time. And as I had said, if you are focused on the task, for the most part, your reaction remains very similar throughout the task period. Now, for no one, it remains exactly the same. There's some kind of a variability. But what our study suggested was that mindfulness training was really associated with a reduction in response time variability as well. Now, you may be asking, well, mind wandering is great, but what about attentional control? Does mindfulness training improve attentional control? It reduces mind wandering, but what about attentional control? Trust me, if that result was significant, I would have showed that result first. So both mindfulness training group and the lifestyle education group showed an improvement in attentional control, but the difference between the two groups was not significant. What we found, and this is a very exploratory analysis, this is a pilot study, so I do want you to walk away knowing that this is one of its first results of its kind, and this result definitely needs to be replicated before we can go forward with more interpretations on this, is that we did an exploratory analysis where we said, what if we stratify? What if we divide our participants based on baseline cognitive capacities? So we assessed working memory abilities, which is often used as a proxy for baseline cognitive capacity. And could that moderate the effect of the intervention? And what this figure essentially shows is that mindfulness was effective at improving attentional control only for older adults who had high baseline working memory capacities. This was not true for the lifestyle education group. So you see the high working memory group in the mindfulness training, that's the group that benefited the most for attentional control. Now, this is an important question because a lot of the times NIH has been curious in asking, could mindfulness training potentially be used to stave off the decline that you see in individuals with Alzheimer's disease? Now, this very preliminary evidence suggests that when you think about mindfulness training, it really needs to be thought about more in terms of a preventative intervention. So this is an intervention that needs to be that individuals need to be engaging in before the cognitive decline really starts to set in, and especially much more in a much more pronounced way, as you would see in individuals with MCI or Alzheimer's disease. Now, a completely alternative interpretation for this would be, this was a brief intervention, and here we looked at a 4-week intervention. So we could also see benefits for the low to average working memory group, even if we did the intervention beyond the 4 weeks. And in fact, our current study that is ongoing right now takes this 4-week intervention into a 12-month intervention. And the hope is that we will be able to improve attentional control, not just in the high working memory group, but also in the low to average working memory. So this pilot study suggests that mindfulness training reduces mind wandering and potentially improves attentional control in those with high working memory capacity. I think what was also really interesting for us to show in this study was that the expectancy was not expectancy effects, right? So did our participants in the two group expect to get better? It did not statistically differ between the mindfulness group and the lifestyle education group. There were still more people in the mindfulness group that endorsed getting better, but we worked really hard at reducing demand characteristics. And the other question that sometimes we get asked is, well, is there a correlation between how much people expected to get better and how much did they actually improve, how much did they actually improve in terms of mind wandering and attentional control. And the answer to that is no, we did not see a correlation. So even though the participants in the mindfulness group did expect slightly more to get better than lifestyle education group, there wasn't a correlation between treatment gains and expectancy. So these were the results of our health trial. And like I said, I won't talk about the CERT-MS study, but we've also shown that mindfulness training can help reduce emotion dysregulation in individuals with MS. This is a group that is predisposed to mood and anxiety disorders, and emotion dysregulation is a transdiagnostic factor. But one other thing that I wanted to just kind of touch on is that in parallel to this research on mindfulness meditation, my lab has been spending a considerable amount of effort in very systematically developing biomarkers or brain-based mechanistic and endpoint markers of treatment gains. There are so many studies that are interested in looking at what is happening in the brain when people engage in mindfulness meditation. And unfortunately, this literature hasn't really gone in and developed those sophisticated biomarkers. So we have been really working at trying to develop whole brain-based biomarkers that we can conclusively say, if there is a change in these markers, that is what reflects better performance. So one of the findings that has been replicated across a number of different studies is that aging is associated with a limited capacity for flexible recruitment. What that basically means is that as we get older, there is decreased responsiveness of different regions of the brain. So a number of the different brain regions are activated when we're performing the task, but when we're performing something more challenging, this kind of flexible recruitment that you often see in younger adults is not present. And this is seen not just in the prefrontal cortex, but in a number of different brain regions of the default mode network as well. These are just different networks of the brain. Now, in the last decade or so, we have been moving away from just looking at one or two brain regions of the brain to what is called the network theory of the brain. So essentially, we're using network science to try and study how different brain regions interact with one another in a dynamic way to produce a lot of these cognitive constructs that we're interested in. So even as you're attending my lecture right now, you're paying attention to it, you are ignoring all of the mind-wandering thoughts. That takes a network of brain regions. It's not just one or two regions of the brain. So it takes a network of brain regions that are activated when you're engaging in these cognitive processes. So paying attention being one of them, remembering different details about your day being another one. And network science is essentially a new approach to studying how different parts of the brain are interacting with one another. And you can really use it to study your Facebook networks, your social network. And when applied to the brain, it really results in a number of these different specialized networks of the brain. And so one of the things that my lab has been looking at is, what do you see as you get older? So what are the age-related changes in functional connectivity we see with advancing age? This is a study that we just published in Journal of Neuroscience, where we looked at 700 participants from the ages of 36 to 100 years old. And what we find is that with advancing age, there is decreased specialization of our brain networks. And this is just a fancy figure showing that that kind of decreased specialization is true across the entire brain. And what we have been using is, what we have been working on is what's called a sustained attention CPM. So when we realize that with advancing age, there is decreased specialization of the aging brain, we have been working on developing a neuromarker of sustained attention using whole brain functional connectivity. So going back to this idea that when you think of attention, it's not just one or two regions of the brain, but multiple different regions of the brain that are working together in synchrony to produce attentional control. And so this attention network predicts over a large amount of variance, so about 70% of the variance in sustained attention performance. And what's really important for a neural signature of attention is that it not only predicts one domain of attention, but multiple different domains of attentional control. And this neural signature of attention can also be generalized to predict performance in younger adults as well as older adults. So what we are doing in the lab right now is we are finalizing a 6-year mind-body intervention that we have been carrying out for healthy aging using all of the data that I have just presented to you. In this study, what we have is participants engage in 8 workshops on mind-body interventions. So we're providing them with training on all sorts of different techniques like mindfulness, meditation, nutrition, social support, sleep, and physical activity. And we do a number of different assessments from the go-no-go test that I presented to you. We're collecting data on the neural signature of attention that I just presented to you. And we also collect blood data to look at how mindfulness intervention can have an impact on markers of inflammation. And then they go through the 8-week mindfulness-based stress reduction program. We do the assessments again, and then we follow these individuals for 12 full months, providing them with booster sessions every 3 months. And what's really important and interesting in this study is that all of our participants are provided with a mobile application where they can access all of the practices in a community-based forum. So if you were doing this with your friends, you can tell if they engaged in the practice for that day or not. And participants are invited to engage in these practices for 5 days a week for 30 days each. And this is a study that has just ended, and hopefully in the near future, we will be able to come back and talk a little bit more about how does mindfulness intervention in this large clinical trial have an influence on a number of different variables. And I'm going to end this talk by really just mentioning that when you hear about the term mindfulness or mindfulness training, it's really being shown as a panacea for all sorts of outcome variables, from cognition to sleep, to relationships, to heart health, emotional health, pain, and neural functioning. We're only just beginning to get data on does mindfulness causally influence all of these different variables. And we have some promising data, but there's a lot of future work that needs to be done. And to just briefly talk about the future directions in my lab, we're going to be examining this impact of a 12-month mindfulness trial on the network strength of the sustained attention neural signature that I just mentioned to you. In our studies and much of psychological research, there's an urgent need to go beyond proportional representation. Many of our studies have a very small percentage of minoritized participants. If we are to generalize to the growing and diverse US population, it's important that our studies also have adequate representation. We're also interested in looking at the dose-response relationship between the studies. If the more you engage in mindfulness practice, do you get more benefits? We're still assessing that. And then what about the presence of neurological disorders? If you have Parkinson's disease or Alzheimer's disease or mild cognitive impairment, could mindfulness be beneficial? Well, we're looking at these and many more questions in the future. I'm going to end my talk by thanking a village of researchers who really work hard at doing this research studies and executing these randomized controlled trials. If you're interested in our lab's mindfulness materials, we have a YouTube channel where all of the materials that we have developed on mindfulness meditation are freely available. Thank you for your time, and I look forward to your questions.
Thank you, Dr. Prakash, for a most informative and insightful lecture, and I'm sure that it has stimulated comments and questions from our audience who would like to have their questions answered. So we now have time to review your comments. These have been clustered by categories so that they may be combined with others. First question is, how can incorporating mindfulness into daily routines help support brain function as we grow older? Can you provide some practical examples?
Absolutely. That's a really good question. And I want to say that, conclusively, once we have the results of our current study, we will be able to tell in a much more conclusive way how mindfulness training can impact the connections of the different brain regions. But I'll summarize, I'm actually working on a review article right now, but I'll summarize the current state of the literature. So one of the things that mindfulness meditation is associated with is a reduction in activity of some of the brain regions that are involved in mind wandering. So the default mode network, this is a network that I had presented when I was presenting some of my brain imaging studies. It's a network that's really activated when we're engaging in mind wandering. When individuals practice mindfulness meditation and they actually go through the training program, what studies have shown is that mindfulness meditation results in a reduction in activity of the default mode network and actually an increase in the activity of what's called the frontoparietal network, which helps us focus on whatever it is that we're trying to do. So it gets a little bit easier. Now, I think a question that you had asked was, how could it help as we are aging? One of the things that we have found in our research studies is that as we're getting older, the different networks of the brain start talking to one another, resulting in a reduced specialization of these canonical networks. And so what mindfulness meditation allows us to do and has the potential to do is to increase the specialization of these different networks. And we have a study that is actively ongoing right now where we're looking at this increased specialization at lots of different levels of the brain. So we're looking at the different, at the nodal level, which is individual brain regions level, or we're also looking at how it impacts specific networks of the brain. And we're also looking at how it impacts whole brain connectivity. So we'll have more concrete answers for you, hopefully in a year or so.
Thank you. And we have another question. Are there any mindfulness programs that could be used in, for example, memory care programs or adult day programs?
Thank you for this question. This is a really important question. And one of the things that COVID-19 taught us that before the pandemic, all of the mindfulness classes, all of the mindfulness programs were really being offered in in-person sessions, which really limits the accessibility of a lot of these programs. Now there are quite a few online mindfulness-based stress reduction programs that people can access at wherever, pretty much from anywhere in the world. In fact, John Kabat-Zinn frequently on these social media platforms, whether that's Facebook or YouTube or even X, offers these mindfulness programs. Our lab just recently received an NIH grant where we're developing a completely asynchronous mindfulness program that can be shipped out to any senior citizen center or a memory daycare center or an adult day program, as you were mentioning, and individuals can proceed on it, can do that on their own. But one of the questions that we have on our end is that feasible to do? A lot of the work that has been done with mindfulness requires the presence of a facilitator. So when you take that component out and you actually have these programs being offered in an asynchronous platform where participants are expected to proceed on their own, are they still efficacious? And this is something that I think more and more research studies would be investigating, is to how do we improve the accessibility of these programs and still see the benefits that we would like to see.
Thank you. Another question, older adults often complain of pain. I've heard that MB meditation can help with pain. Might there be a connection between pain reduction and cognitive function?
Absolutely. This is not my area of expertise, so I'll take this with a grain of salt. In fact, mindfulness-based stress reduction programs, when they were first launched by John Kabat-Zinn, it was to work with participants who had chronic back pain. And these were individuals who had gone through back surgeries. They had been on several pain medications and nothing was really helpful. So the first set of programs where they investigated the efficacy of mindfulness-based stress reduction was for pain. So there are quite a few studies that have shown that mindfulness programs can be effective at reducing pain. There is some literature that has shown that pain has both a sensory component as well as a subjective component. When individuals do learn how to manage the subjective component of pain, there is an association between pain reduction and cognitive functioning. Now, I haven't really looked at this literature very deeply, so I wouldn't be able to say if there's a causal relationship between pain reduction and cognitive improvement, but there's definitely a correlation that I have seen.
Thank you. We have another question. Regarding randomized trials, would the socialization of the group after the training impact the study because perhaps the folks in the group experienced less loneliness?
That's a fantastic question. So in our studies, both groups have a socialization component, and that's what I was mentioning, that it's really important to do these randomized control trials that control for all of these different variables. And this is my personal opinion that when I was saying that mindfulness, should we be thinking of it as a panacea? Is it the end all and the be all? I don't think that's the case. In fact, I do think that there are multiple pathways to health. For some people, it is mindfulness meditation. For others, it may be exercise training. For others, it may be cognitive training. But I think a really important component in all of these is social support and social community. Hopefully to this group, I don't have to say it's not Facebook friends, it's actual real social support that you develop through these different communities. It's very likely that a lot of these effects, so even when both groups have the social components, it's possible that mindfulness is interacting with the social component and producing its effects. And in fact, there are quite a few studies that have looked at how mindfulness training can help reduce loneliness. It can help reduce markers of inflammation. So I do think that socialization is a really important component of this.
Thank you. We do have another question. Are there any studies enrolling virtual participants?
I'm sure that there are. If you go to clinicaltrials.gov and search for mindfulness and online, there are a list of studies that come up that are funded. And this is mostly within the United States, in case if there are people outside the US listening in as well. So most clinical trials that are sponsored by the NIH are available on clinicaltrials.gov. And for people who are interested in this, they can select if there are studies that are enrolling participants virtually.
Thank you. From a student reporter at the URI newspaper, this paper is called The Good 5-Cent Cigar, for your information. One question I feel readers would be interested in is, what inspired you to start studying the science behind mindfulness?
Oh, the students always get you. It's a really thoughtful question. And in clinical psychology, we always say we're not researching, we're me-searching. I think that, I pursued a path of having an academic career, and it is, of course, a path that has been stressful. And both my partner and I are in academia, and we were pursuing our graduate programs and thinking about going on the job market. And I started doing a practicum on mindfulness meditation. I came from the background of looking at exercise training and how it impacts brain plasticity. And as soon as I started engaging in mindfulness meditation, I still remember the first meditation practice I did. My facilitator rang the bell and invited us to focus on the breath. And that was our invitation. And it was just a 10-minute practice. And I was like, well, how hard could it be, right? You ring the bell, I can focus on my breath. Turns out it was one of the hardest experiences I had. It's extremely challenging to stay on task or stay focused on your breath. And my mind wandered everywhere, from planning new research studies to when I was going to go visit family, to dinner plans, and everything in between. And that's when I realized how important mindfulness really was for my own well-being, and how much potential it had to reduce mind wandering and improve cognitive functioning as well. So yeah, that's how I got started. I did a practicum on it and realized that I needed to research it in a much more thoughtful way.
Thank you. I think we have reached the end of our appointed hour for the lecture, and I want to take this time to thank Dr. Prakash for being our 2024 Thewlis Lecturer on Mind Matters, the Impact of Mindfulness on the Aging Brain. And we hope that all of you in the audience who have attended can take away something that you can apply in your own lives and in your own work with older adults. We are grateful for all of the people who have been behind the scenes and to help the production of this lecture. There are many people that you have not seen, and we want to extend our sincere appreciation for all their work. And we hope that you, as the audience, have a good rest of your evening. Thank you.